I look extra rough. I just came back in. Excuse me, because the struggle is real. So I'm just all sorts of just annoyed, disgusted. Absolutely disgusted. At this point, broke, busted, and disgusted, but I digress. So I just went to pick up my medicine from my doctor, my pain medicine. Now, keep in mind, you, if you know me, you know my pain has already not been controlled. There are times when it's better or manageable, but most of the time it's not. It prevents me from wearing a shoe. It prevents me from going out. It prevents me from doing a lot of activity. And when I do activity, I get a wound. Like I was doing the physical therapy program and then got a blister, which turned into a wound, which turned into half my toe coming off, which turned into me no longer having a toenail, which turned into me going to wound care and drama. Okay, nothing can ever be simple. So I had my appointment with pain management and I'm telling them, like, it hurts when anything is on my feet. So I have like three dressings on my foot. Four. So I don't know if it's the dressings because they're like on my foot. I'm trying to keep them dry, trying to keep them on. They're supposed to be stay on for 7 days. How I'm supposed to do that and they're not waterproof and not fall to my death, which wouldn't be so bad right now, but I don't know. Anyways, another tangent. I don't know. So regardless, my pain has gotten worse. And keep in mind, I was on an antibiotic whenever I first got this wound. I've had x-rays because it's gone down to the bone, like to see how much needs to come off, blah, blah, blah. Like, I've been going to wound care for 4 or 5 weeks now. And there was like a 2 week delay for me to even get in there. And I was on like a 10-day antibiotic before I even got in there. Okay, fine. So it's been like a minute. It's really been a minute. Like, why it's not healing, they don't know. I have good circulation. Like, I'm a bleeder, that's for sure. Shorty got blood vessels, but I'm a bleeder. Anyways, another side tangent. So I have my pain management appointment. So I'm telling them all this stuff like it hurts to walk because if you've ever seen my feet, oh my gosh, I hate my feet. But my second toe is almost as long as my first toe, except for there's like a little curl, like your toes curl under whatever on toes 2 through 5. Okay, fine, no problem. So whenever like I walk, it's on like the top of my toe, which is where the wound is. And they have like a foam absorbent pad there because it was draining. And it's like taped it's not comfortable at all, but it needs to be like that to absorb the drainage. I get it. So it hurts whenever I walk, like literally. It hurts whenever I have a flip flop on, like a shoe, because that's something like um hard that like my toe is pressing up against. So why, if I'm telling you that I'm having all this increased pain because of this acute problem, you feel like the solution is to decrease my pain medicine? Are you stupid or are you dumb? Like, at this point, unacceptable. And you didn't say anything about it. I had an appointment. My appointment was 35 minutes daggone near. And you didn't say anything about it. You didn't say anything about changing my prescription. You didn't say anything about what your plan of care was. You didn't say anything about your professional opinion. You left it up to me. I made a decision to keep my medicine the same for now, especially when I'm dealing with this acute problem. And we left it at that. That was that. It was supposed to be the same as it was last month. Okay, well, my prescriptions are not the same. And then someone did have a good point. Well, maybe it was a mistake. Maybe you need to call them, because by the time I realized it, the office was closed. I just happened to be going over my medicine because I'm taking it, and I'm like, this pain is getting crazy. Like, it's really getting out of control. Like, I'm really like, I honestly, and I don't know why I'm laughing because it's not funny. I guess I'm laughing to keep from crying. But I honestly was like thinking about going to like the psych ward because it hurts so bad. It makes you suicidal. Like, and it's every day at this point. Every day, most of the day, if not all of the day. Right now, it's extra bad because I actually did get a little bit of sleep, but a blanket, it folded down on my leg, so it irritated my whole leg. And it's already the leg that has the big wound on it. So it was just bad on top of worse. And it literally was so bad. I was honestly like thinking about going to the psych ward just to like keep myself safe, because I literally could cut my carotid and not think twice about it. Like, literally at this point, I'm sick of it. Those people with chronic pain understand what I'm talking about when you get to that point, when you're at your breaking point. And I've been at my breaking point so many times. And my primary care doctor has a point. He's like, if you do something to yourself, it's so selfish. It would be so selfish. And he keeps starting to hunt me down in afterlife, which, I mean, he is pretty determined. So I feel like if anybody can find me after I die, it'd probably be him. But anyways, so I'm like, I considered that it could be a mistake, but at this point, you have over 20 years of service. Over 20. All you have to do is reorder medicine. So you're not checking to see what you're ordering. I didn't have this problem whenever I was seeing someone else, but she had a baby. So happy that she had a baby. So happy. Praying for her. Happy for her. Definitely want her to take the time that she needs, but it's hard finding a doctor that's going to go to bat for you, that really cares about you. And then whenever they go out sick or they have a baby or whatever, like, you're just stuck, like, you're just left to the wolves, basically. So now tomorrow, I'll be up at 9 o'clock. Usually, if I'm going to go to sleep, I go to sleep around like 7:30, 8 o'clock. No, tomorrow I will be up till 9 a.m. to call them. If I do not get a call by 11 a.m., then I will be there at 1 a.m. That gives me enough time to take a pain pill and get myself together and get down there to see what is going on, because this is ridiculous. Like, there's really no excuse. There's really no excuse. It's not like it's just a routine, like, oh yeah, my hip hurts, so I'm coming to get some pain pills for whenever it really starts acting up. Oh, it's about the rain. I feel it in my hip. My bones are aching. No, it's not that. It's really not that. And furthermore, furthermore, if you know me, I've been a nurse for like 10 years. I used to I'm a big girl. I've always been a big girl. This is a lot of weight to carry around. Even before all this started happening, my feet would hurt. I'll be working 12, 14, 16 hours. I have bulging disc in my back. Like in three places. And I'm not even I didn't even complain about my back pain. That's not even why I'm going to pain management. Like bulging so bad that I have to go and get like routine imaging. I had to go get my imaging done over to make sure that they can fit the implant like into my spine, make sure that it's not going to affect this implant, make sure that the leads will be able to be slipped into my spinal cord, whatever. Okay, that's fine. Like, I'm not even really there for that. I didn't even mention that until they tried to give me injections in my spine to help with my feet and legs. Like, up until then, I didn't even care about my back. I don't even care about like my bulging disc. And yes, it hurts. Yes, whenever I'm laying here, I have to switch sides every hour and a half because my legs fall asleep, or it increases my pain, or my feet get like red or swollen or whatever. Like, yes, all of that. Or yes, my hips hurt because my back is hurting, so I walk funny, or like it throws off like the alignment with my hip. Yes, okay, that's not even my issue. And this was before I was taking pain medicine. Like, that's not even my issue. My issue is my feet, like in my legs. And I don't understand. I don't understand. And I hate to say this. I really hate to say this, but I was telling my therapist, like, I understand how people can be racist, how easy it is for someone to be racist. At this point, if it wasn't for and I really feel bad because it really used to annoy me. Whenever I used to call my insurance, I would get these little ghetto black girls that you could tell was straight from Baltimore City, not the county, not behind the city county line, like down the hill. And it used to get on my nerves. Oh, it used to get on my nerves. But then I got a care manager. I got these other people. Okay, fine. They were easy to talk to, but they really ain't care. They ain't care. They did not care about me getting the care that I need, me getting the things that I needed. Like, none of that. Didn't care about any of that. So finally, at like the end of last year, like December, I was tired of it. I was like, I'm not talking to anyone unless they're black. I'm absolutely not talking to anyone unless they're black. If I can't, and of course, every now and again, you have the exception to the rule. You'll have someone who's not black who might sound urban, or someone who is black that might sound quote unquote white. You know, that's a whole different argument for a whole different day, but you know what I'm talking about. Don't try and nitpick. But unless they're black, I'm not talking to them. Like, I would hang up and call back because that's the only way I'm going to get anywhere. That's the only way I was getting anywhere. That's the only reason why I got this trial now. Like, if I wasn't hanging up trying to talk to black people, because I know they care. Like, it's one of us. Like, I don't care where it is. Like, there's just a underlining like sense of community that we have for each other. And if they weren't black, I wasn't talking to them. And now look, oh, all of a sudden, oh, you got my surgery approved. Okay, that's great because I've been waiting 8 months for that. Oh, okay, you got this consult. Okay, that's great because I've been waiting a year for that. Oh, you finally got the trial approved. Okay, that's great because I've been waiting a year and 2 months. Yeah, it'll be almost a year and 3 months for that. Thank you. Thank you. Like, Jesus. And that's why, like, and I'm not saying that it has to be somebody who's a minority because Lord knows, like, my pain management doctor, oh, I love her. She's so sweet. She really went to bat to me for me. She was really trying to find someone who wanted to help me. Like, I don't want to be like this. I'm not like just give me pain medicine and let me sit here. Like, I am willing to do whatever I can, try whatever is available to try and get my life back because A, number one, how people treat minorities, and number two, how you treat people who are poor, like how you look down on them, how you think you're better than them, like how you turn your nose up at people. Ma'am, ma'am, sir, are you though? Because you're ugly. Your attitude's ugly. You treat people poorly. You do. And that's not cute. That's never a good look. Anyways, but yeah, the doctor that's the doctor that is doing my stimulator, the doctor that's doing my implant, the doctor that's doing my clinical trial, black. I think they're like immigrant black because I don't know where he immigrated from. So I'm gonna just say immigrant black. He's something. He's something. I don't think he's Middle Eastern. I really think he's black. He could be, not sure. But if you look at him, you gonna think he's black. He's a minority, okay? The ladies that I started talking to at the office, black. And matter of fact, I wasn't even talking to the lady who does the approval. Like it doesn't even have to be the right person. Whenever I was getting someone to call for my doc, whenever I was talking to someone at my doctor's office to get them to call my insurance company, it wasn't even the right person. It wasn't even the person that does it. It was someone black who worked in the back, literally in the back, coaching me, telling me who I needed to talk to, what I needed to do, and how things work. Literally. She's like, okay, we're waiting for a call back from a department that doesn't even call back. So you need to call this person, ask to speak to this person. If they're not there, leave them a message and have them call and speak to this person and give them this reference number that they gave us to see that we called. Like just coaching me step by step. And the sad thing is, like, I would do that for anyone, not just someone who's black, but because I know the people who are willing to go to bat for us and the people who are willing to look out for us, the people who are willing to break their back for us that don't look like us are limited. I'm absolutely, if there's something that I can do like to go extra hard, I'm absolutely going to do it like above and beyond. Like I'm a person whenever I went to work, like I'm going to do my job and I'm going to exceed, hopefully, except for that one time I had those racist patients in Idaho. But generally, exceed like your expectations, like go above and beyond what I'm supposed to do. If I'm supposed to check on you every 2 hours, I'm going to check on you every hour, or make sure that, I answer your call late whenever you promptly whenever you do call out to us, or check if you do need pain medicine, or make sure that the pain medicine is working, not just like the reassessment, but follow up after that to make sure that you're comfortable, to see if there's something else that we can do. Like just whatever it is, I'm always going to go above and beyond. Like that's my job. That's what I signed up to do. So Why people can't do the same, I don't know. And you already know how it goes. You already know how it goes. Black people in healthcare, they think we're the help. They think we're the janitor. They think we're housekeeping, environmental services. Like they always want to speak to somebody over you, which I think is funny because I'm like, okay, well, the charge nurse has 3 years of experience, or sometimes no shade, no shade, no tea, just a year of experience, and I've had 7. So, truth be told, they're asking me questions. And I'm not like pompous. I'm not like, oh, I know everything, because I can learn somebody who just learn from somebody who just graduated. And a lot of times I'll keep a new grad in my back pocket because they remember all the labs, they remember all like the little stuff that you learn like in lecture that sometimes just slips your mind whenever you're in the clinical setting. Like it's not something you think about, it's not something that you use, but it's something that you've been taught that might be helpful, you know? So I always keep a new guide in my back pocket for real. So that's that. Anyway, I've rambled on enough. I I do feel a little bit better now that I got that off my chest, because I'm telling you, I had a headache. I do have a headache. I know my blood pressure was probably up. Just so worked up, so stressed out. I meant to take something for anxiety. Like, just too much. Too much and not enough at the same doggone time. Anyways, well, this is long enough to be a video by itself. So, subscribe, comment, like, share. Let me know what your struggles are. If you have a chronic condition, illness, either or both, um, or just your struggles with healthcare, period. Maybe it's just because of the current situation we're in worldwide, um, the panorama, or maybe it's just your location. But that's a whole nother tangent that I don't have the time or the energy for. I done wore myself out. I only had like maybe 2.5 hours of sleep, and that was broke up because of my pain. So, all right, y'all. Till next time. Peace.